I'm Jill Newby. I'm a Professor of Clinical Psychology and the Head of Clinical Research here at the Black Dog Institute. So my research is mainly focused on helping adults with depression and anxiety, and I do that in a few different ways, but it's trying to make evidence-based treatments more accessible to people with depression and anxiety through digital methods, so using technology to help deliver evidence-based treatments to people in need. So how I got here, I did undergraduate psychology degree, and then I did my honours in actual neuroscience. So I was working with rats, looking at the neuroscience factors that related to alcoholism. But that was in the laboratory, and I thought it was way too far from the impact. So what I ended up doing is working in an anxiety clinic. And in that anxiety clinic, we use digital tools as well as face-to-face therapies to help people with anxiety. And I got really interested in how we can make these treatments more available to many people in the community to help those in need. When I first got here, I started on two main projects. So the one that was going to be my sort of longer term project is one called Adult Wellbeing. So it's looking at how we can improve the treatment of depression and anxiety through blended care, where we combine a digital component. So that's a smartphone app that we have developed in combination with psychological therapy to see whether if we combine the best of both worlds, can that actually combine to get better outcomes for clients and also better outcomes for psychologists to save them time, to reduce the administrative workload that they have to do, and to sort of be able to spend time with their clients on the work that matters. So that's one project that I had planned to come here and focus on. But then the other project I ended up spending most of my time on was 10. So that's the Essential Network for Health Professionals. So we were fortunate enough in getting funding from the federal government to develop a blended care service where we were helping people who were health professionals on the front line for their mental health. Because we knew with the pandemic they were at risk of poorer mental health, more anxiety, more trauma, more depression, higher burnout, and also at risk of leaving the profession because of all that strain that the pandemic placed on them. So 10 was a way to help make information, advice, screening tools and treatment interventions more accessible to health professionals, to help their mental health and to help them cope through the pandemic. So a lot of my time was actually spent on helping set up that service, helping set up an app, helping set up the website and writing some of the content for that. So if you want to learn more, it's actually a really good idea to go to our website. We've got information about a range of different digital products and tools that are available for people in the community. We've also got information about the types of projects that we're working on, so that can give you a bit of a deeper dive into some of the research that we're doing here at the Black Dog, and get involved with some of the fundraising activities, because that can help the most. It can help support the research that we do so we can help more people in need in the community and help solve this problem of mental health in our community.